Studies show 1 in 5 people struggle with mental health issues, and police officers are not immune. With the career under fire, stress is leading to some scary outcomes. CBS 21's Michael Gorsegner dives into the problem now and what's being done to protect the men and women who keep us safe.
I always wanted to be a police officer, and I became a police officer.
And for 20 plus years, Stephen McDaniel serving his community as a member of the Pennsylvania State Police. But that service taking a toll.
Sorry about that.
Even after 33 years of trying to bury the memories, a horrific crash along the Pennsylvania Turnpike in 1988, fresh in McDaniel's memory. 6 people dead, including a family of 5, burned to death in their car.
I cried all the way home. I cried for 2 hours.
Their job is to respond to your worst day. That's all they do is see bad days.
And that pressure and stress leading to an alarming trend, suicides. Since 2017, BlueHelp.org tracking 647 law enforcement officers taking their own lives, 56 already this year.
Suicide among law enforcement, unfortunately, has the potential to be the greatest outcome as a result of the current environment.
A deeper look at the comparison shows an alarming trend. Between 2017 and 2020, 801 law enforcement officers across the United States were killed in the line of duty. In that same time frame, 591 officers took their own lives. Some experts saying that those numbers might not even be correct because many times suicides are not documented properly and they are just simply not investigated in the same way.
It is a very prevalent issue in what police deal with on a daily basis.
Besides the climate of policing nationally, another huge stressor for officers, mental health calls. Before the pandemic, 1 in 5 people believed to be suffering with mental illness. Now, some believe that number growing to 1 in 4.
We are definitely seeing an increase.
Generally, the first to respond to any mental health crisis, police officers. In 2019, York County 911 receiving 1,700 mental health calls for service. To prepare the officers for certain scenarios, NAMI, the National Alliance for Mental Illness, York Adams, running officers through a 40-hour crisis intervention course.
It's not to incarcerate them, it's not to arrest them. Really the basis behind it is to go out and try and find other avenues to deal with whatever problems.
To date, the CIT, or Crisis Intervention Team, training 161 officers countywide in different techniques to deal with, talk to, and engage struggling people.
It's really important for us to know where to send people and how to help them.
You know, most people, when they see a dog, it makes them feel better.
Easing tensions for both citizens and officers, a major factor of why the York City Police Department added victory to the squad. A simple pet of the belly, helping to de-escalate a situation or engage an officer after a bad day.
Brings much better community engagement and just the interaction and perception of what law enforcement really is here for, which is to serve and protect.
Resources exist for officers and the general public, from peer assistance groups for police to deal with chronic and traumatic stress to NAMI's cachet of free programming. Coping with the issues of the mind is critical.
I really believe we're just now seeing it. I don't believe we've seen what's coming yet.
For CBS 21 News, I'm Michael Gorsegner.